Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. As many of you know, the NSCHBC is a proactive organization with over 300 members, including legacy members, who we share our wealth of knowledge and expertise with each other and also with our members and with our potential members, whether it be in the legal field, the accounting field, the RCM field, the business management field, value-based care, AI, and more. We have every kind of consultant that focuses on the healthcare industry that you could want. Today I am going solo. I've done that in the past, but there is a focus that I wanted to use for our discussion today, and that is on telehealth. There was a new study that was just published from the Centers for Connected Healthcare Policy, CCP, and this is an agency that is tied to CMS and HHS, and they weigh in heavily on all things healthcare, and then provide compliance models, insights, and information also to the Telehealth National Resource Center. So if they're saying it, the government listens. Now, my background, as most of you know, is as an educator and auditor, and I do have credentials in telehealth, E&M services, and virtual care, also in prior authorizations and compliance. So I feel like my, SME on this, subject matter expertise, it definitely follows a lot of these things that I'm hearing and reading about, especially this new study with the CCP. What I found interesting about this study is that they also took into account what patients are saying. And this is important because for those of you that are in the telehealth space, I think sometimes we focus too much on coding, billing. Can we have that? Can this be done virtually? Instead of looking for the specifics to the space that we're in, meaning that how do you build a conducive space for the patient and for the provider to make them happy and make sure that it is likened to an in-person service? So a commonly cited concern regarding telehealth utilization is that it may not provide an equivalent experience, or sometimes I've heard even offer an inferior one for both patients and providers due to the absence of shared physical presence. So for example, one concern has been raised includes missing patient nonverbal cues, as the provider may not be able to view all of the physical manifestations of the patient during a video visit. So these types of telehealth limitations have led to certain policies being put in place that may require or do require in-person interactions. An example would be under the permanent Medicare telehealth policy. If a person is receiving services for mental health via telehealth in their home without being treated for a co-concurring substance use condition, they must have had a prior in-person visit with the telehealth provider at least 6 months prior to the start of the telehealth visit. So now that requirement actually has been put on hold until 2027, but if they are under any kind of opioids or substance abuse, then they do have to still have that in-person visit. But it also reminds me of a recent situation I had with a neurologist where they were telling me, as much as they appreciate the virtual space and being able to use that, one of the things that can be seen in an in-person visit is when a patient stands up out of a chair in the exam room. They can see if they struggle. They can see if they have to push up. They can see if the patient has tremors. And they don't see that on a video presence, or especially not in an audio-only presence, and patients don't really volunteer that information. So while it is widely acknowledged that the lack of physical presence can provide challenges or even make telehealth sometimes undesirable as an interaction, there are also many situations where telehealth can provide good and in some cases better results than in-person interaction can provide. However, it's not to say that physical environmental factors are irrelevant. While the patient and provider may not be in the physical presence of one another, sometimes the environmental elements at both ends of the interaction can still influence the effectiveness of the telehealth visit. And I wanted to discuss that, or at least explore it here today. And I know sometimes it's hard to tell if I'm actually a proponent of telehealth. I absolutely am. But what I find just disheartening sometimes is that I do have practices that have said everything should be virtual, and that's not the case. There are certain things, and I mentioned one for neurology, palpable masses, certain heart disease patients or patients that are having an acute episode. Those need to be in person. There was a recent report, What Shapes Telehealth, and the Communication for Technology and Quality, and this was done by Iowa State University. They published this last year, and it examined how different environmental factors and communication dynamics in telehealth settings can also impact the quality of the interaction. And I know that seems simple, but the study conducted a scan of peer-reviewed articles that focused on patient-provider communication, telehealth communication, environmental factors, and technological influences, and identified key environmental and technological variables that affected communication. One of the things, just as we get into, some of these nonverbal situations and nonverbal cues, remember, if you are providing telehealth, you also have to provide the same or access to telehealth to patients who have a disability or who are under ADA. What if they're a blind patient or a deaf patient? How do you see them virtually? You have to provide tools for them to be able to utilize the same service. You cannot just provide telehealth to one part of your patient population. It has to be everyone gets access or nobody gets access, because that could be discriminatory. So going back to the study, talking about technological influences and certain outside factors that can affect communication, the study noted that while healthcare settings have been designed specifically for in-person interactions, and we know that, the same has not necessarily been true for telehealth visits. I find a lot of times what was done during the height of COVID in 2020, now 6 years ago, nobody updated that information, updated that space, updated how their workflows worked. They said, we are, in a pandemic, so we are doing makeshift, this is what works, and they never updated that. But the authors of that study, here they identified 4 areas where telehealth and in-person communication differed, and let me explain. The loss of nonverbal cues and embodied interaction. So these are the visual and nonverbal cues such as body language or changes in the expression of the patient that may not be easily identified over telehealth. This is one of the reasons why I'm not a fan of the audio only. You can't see a face droop. You can't palpate a mass. You can't see the expression on the patient. You can't have or see or notice those nonverbal cues or distress of a patient. The next one was reduced emotional connection, and this is a big one. Remember, a lot of especially our geriatric patients, they feel disconnected. And when the two parties feel remote, not only physically but emotionally from each other, there can be the lack of shared physical space can make building an emotional connection more challenging. So, for example, if the service is provided in person, physical gestures such as a pat on the shoulder or a hand squeeze can help build that emotional connection between the patient and the provider. Those, just those slight touches, just that personal interaction can make for a more meaningful encounter for that patient and also build trust that you may not be able to do over the virtual means. Variation in patient-centered and perceived attentiveness. This was a really interesting one, and this one I've done one telehealth visit since it was more the norm, and I actually didn't care for it. And I'd rather do that than go find parking at the doctor's office and deal with all that. But patients can sometimes feel that interactions during the visit are more dominated by the provider, with the patient needing to ask for clarification. Whereas in an in-person visit, that can feel more collaborative. Because again, you have a lag with the internet sometimes and with audio and video connection where there's a quiet space or there's basically a 5-second delay or silence that a lot of people don't like, and they think that, okay, this is done. And the writer notes also in this study that this may not be widespread experience, but these comments did appear on some studies and was frequented by a lot of patients. One other scenario that has also been identified in some of these studies is the perception of being attentive to the patient. Some patients have noted that their provider seems less engaged or distracted over telehealth than they otherwise would during an in-person visit. I see that too. They look down a lot instead of looking into the camera, making sure that they are engaged with the patient. And then the last one in this study, or the one that just focused on shifts in consultation structure. Some of the studies showed stronger average times for video visits compared to in-person. These shorter visits may impact the depth of the consultations and consequently the overall service the patient receives. Additionally, some providers defer documentation until after the telehealth visit, whereas in person, sometimes it's done while the patient is still present, and that limits the ability to allow for real-time clarifications with the patient when necessary. They can clarify that right there, and a lot of times the patients, they remember. Think about a phone call that you're on with somebody, and then you hang up, or you've disengaged, you were texting or whatever, and all of a sudden you're like, oh shoot, I forgot to tell him something. Well, that happens. And sometimes when the patient's there, they're just like, oh, I forgot to tell you, as they're walking out to the scheduling, I need to talk to the doctor one more time, and they can come out. But if you've already disconnected from a virtual call, you're kind of done, and getting back to that physician is almost impossible. So some of the other communication challenges that were identified by the researchers said that this also can impact the success of a telehealth visit. Increased difficulty extracting information from the patient in a virtual setting, patients feeling rushed during a telehealth visit, less engaged or hesitant to speak up, integrating interpreters into video visits, that's been challenging. And one of the biggest ones is issues with technology. You've got people in rural areas, and unless they've got a satellite or Starlink or something, it's going to be hard for them because they don't always have the underground cable system or whatever is needed for strong internet connection. So while all of the foregoing challenges have been raised in some way or another by most telehealth providers, this study and the researchers note that little has been done to specifically address the environmental factors that may assist with improving the telehealth experiences for both the patient and the provider. So while telehealth removes the shared physical room, it does not eliminate the environment's influence on communication. So each participant's surroundings acts as a backdrop that shapes the tone and effectiveness of the encounter. How many times, for those of you that do Zoom calls or Microsoft Teams, you get on a call and everyone's on video and you see their backgrounds. Some people use, funny backgrounds. I saw somebody thought they were in the Toy Story movie, please. And then there was another one where they had palm trees swaying in the background, pretend Hawaii background, and some people have a virtual office in the background, and some people actually put their reality settings, which may be a dark room or something. And so that's where it can be definitely a problem, because you really have to look at that backdrop. And growing evidence shows that environmental cues are essential for establishing patient comfort, psychological safety, and communication efficacy in telehealth. Some of the studies that the researchers cite suggest private well-lit spaces, removal of cluttered backgrounds, proper screen placement, as I mentioned, noise reduction. That's a big one. You don't want your kids in the background, or your husband or partner doing cartwheels behind you, or somebody cooking while you're trying to hear your physician, as well as other steps that can help ease patient discomfort, encourage greater engagement and help provide important information to the provider. And so here are some of the key factors in creating a more favorable environment. And there is a positive, I'm trying to give you the upside now, for a telehealth visit. Proper lighting to enhance visibility, good sound control to ensure both provider and patient can hear each other clearly. You really should have a telehealth visit facilitator in your practice. Proper camera positioning to ensure natural eye contact and a clutter-free background. Secure private spaces on both ends. That's huge when you're trying to say you want to be HIPAA protected. An ergonomic setup, a high-resolution camera, a natural elements like greenery that can enhance engagement and ease patient anxiety, maintain a distraction-free environment. And patients should not be allowed to not dress as they would have dressed when they are in the office. We've seen some inappropriate things where patients are in bed and they don't have clothes on, or they're just inappropriate on camera. Now, if it is a patient who's homebound or bedridden or, severely ill, that's different. But when you just have a patient that doesn't take the time, or a provider that doesn't take the time to be professional in the space of virtual care, you're going to have a problem, especially if that ever gets out, especially to a payer. So, authors of this study point out that more institutional attention is needed to address environmental factors in design for telehealth visits. So there are a lot of different resources that have already tried to do this, but make sure that you are looking also what HHS has for this. Look at telehealth resource centers, TRCs. That just telehealthresourcecenters.org. They've provided tips on how to conduct a telehealth visit, and they also have considerations around environmental factors. Take a look at Virtual Care Room Design Kit. That's from California Telehealth Resource Center, where I'm at. Best Practices for Providers, National Consortium of Telehealth Resource Centers. And then there's Make Most of Your Telemedicine Visit for Providers. That's a South Central Telehealth Resource Center. So also, when we talk about technology, everyone talks about technology, noting that minimizing technical glitches helps to improve communication and the overall quality of the telehealth visit. And so high quality microphones and cameras also contribute to the quality and outcome of the visit. Remember, the Skype and the FaceTime and things that are not HIPAA protected apps, you can't use those anymore, not since 2023, August. So beyond transmission quality, the technology can also significantly shape perceptions of the remote environment. So if the quality is poor, it may give the impression of a dark or cold environment. And so, high fidelity connections can enhance impressions of empathy, attentiveness, and trust. So make sure that you are elevating your role of the physical environment and technology design in telehealth delivery. Develop environmental design standards for incorporation into telehealth policy into your office. Promote interdisciplinary collaboration for telehealth environment optimization. Make sure that you are constantly updating and checking this out and making sure that both ends, the provider and the patient, are having an experience that the technology works, the lighting is good, that the patient feels, and this is what they say in the Social Security Act and the Federal Register, it has to be likened to an in-person visit. Encourage future research linking physical environment and technology quality to health outcomes. That's what a lot of different specialty societies are doing at this point. And the reason I say all this is because I know that you want to keep your telehealth space and your telehealth options, open. But if these studies, and I'm seeing more and more of them, start to say that it's a detriment to have telehealth, then we're going to find ourselves losing telehealth in the future, and we don't want to do that. Okay, I hope this was a timely topic for you, as our telehealth COVID era flexibilities, again, were extended through 2027, but there's still work to be done. We need to make sure our virtual spaces for patients and providers meets the compliance and medical standards that in-person encounters do. So thank you everyone today for listening. As a reminder, to find a consultant for healthcare-related legal needs or any kind of healthcare needs for a consultant, go to the NSCHBC website at nschbc.org. Click on Find a Consultant, type in what services you need, and consultants with that background will come up for you in different states around the country. Again, remember, we have accounting fields, RCM fields, value-based care, AI, you name it, we have it. Also, as a reminder, the NSCHBC.org website offers monthly free webinars on a variety of topics, as well as a quarterly Medicare regulatory update. Please go to NSCHBC.org, click on Upcoming Education, and you'll see our variety of topics for 2026 that you don't want to miss. That's it for us today, everyone. Make it a great day, a great rest of your month, and thank you for listening to the award-winning NSCHBC Edge Podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge Podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.